Have you ever been in a situation where you desperately needed help and called emergency helplines in Nigeria? Over the years, Nigeria has committed a lot of funds to provide these services. But the question is, how many Nigerians really get served? Now, in the story, Ayuba Illiya looks at Nigeria's emergency infrastructure and how you can be served better. Have a look.
How would you respond when someone close needs emergency medical services?
It's always better just stay aloof.
The best thing to do is to just call to the hospital, emergency, but I don't know what to call.
Accident at China village by Alapere. Okay, we're on our way.
What is the state of Nigeria's emergency medical services and how does it work for you? According to the National Bureau of Statistics, Nigeria records an annual death rate of 2.4 million, 50% of which are avoidable with an effective emergency medical service. Behind the statistics are stories of heartbreak, lives lost not to illness or injury alone, but to a system that failed to respond. In northwestern Nigeria's Kano State, Binta Isa lost 2 children, an infant and a toddler, under similar circumstances of delayed medical emergency.
My first son was vomiting profusely. We took him to the nearest hospital where we were told there was no bed space. We then moved to Murtala Muhammad Specialist Hospital and we were also told no bed space. From there, we went to Nasarawa Hospital. My son was in a critical condition.
According to UNICEF, Nigeria's infant mortality rate is approximately 74 deaths per 1,000 live births, and under 5 mortality rate is around 117 deaths per 1,000 live births. In Ibadan, capital of southwestern Nigeria's Oyo State, Moshood Adewale's wife had complications during the birth of their twin babies. After the first twin was delivered, they were referred to another hospital because the second twin was trapped.
I said, okay, can somebody follow us so that you'll be able to manage from this point to that? They said no, they don't have enough people on duty, that I should just use one cloth to pack the head of that second baby that was coming to take her to the private hospital. On getting there, they said the baby was too weak, and they had to do some medical process on him. But eventually, we lost the second baby.
Nigeria's ambulance to population ratio currently stands at 0.4 to 100,000 people, a far cry from the World Health Organization's benchmark of 1 per 10,000 people. Folake Owoduni runs one of the few private emergency services in Lagos, Nigeria's commercial hub.
It costs, I would say on average, maybe about 60,000 naira, give or take, another 10 to 15,000 naira, depending on the provider that you're working with. And if you think about that number and you think about the fact that our new minimum wage is actually 70,000 naira for a month, you can imagine that it is automatically unaffordable for most people.
In 2019, the federal government launched 112, a toll-free number designed to connect Nigerians to first responders.
At the moment, they have covered 24 states from the 36 plus 1 FCT, and the 112, if you call at the moment now, you understand, you hear that 112 and they will respond. So when they respond, what will happen? They route the call to the state that is operational.
However, 112 is only a number without the emergency operational infrastructure in many states. In February 2022, the National Emergency Medical Services and Ambulance System, NEMSAS, was created to strengthen response efforts nationwide.
What we do is that we buy the services. If you have an ambulance, we empanel the ambulance, we find it to be eligible, we empanel it in our database. Now, you provide the services, then we pay you. We have empaneled 25 states and about 9 states are operational.
I know that in FCT in Abuja, there was a pilot program that happened for a period. But if you go to the common man, if you go just to different parts of the country, you're not going to see an active, functional system.
As with many states across Nigeria, Northwestern Kebbi is at the preliminary stage of domesticating the National Emergency Medical Services and Ambulance System program.
We sent invitation, and officials from the National NEMSAS office were here in the state, and they made assessment of our readiness.
Studies show that for about 60% of Nigerians, 112 is a little more than a rumor.
I'm not aware there is any code like that in Nigeria. No, I'm not aware.
I'm not aware. Have not even heard of it.
Those codes are not very reliable.
Experts say creating more awareness about emergency medical service is key to changing the current narrative.
One of the most important is the first responders, the bystanders around where an emergency would occur. People don't know how to react. People don't have that knowledge.
We have yet to help people understand how to recognize emergencies and what the appropriate steps to take are when they experience one.
When you have an emergency in Lagos and you need help, you need to call 112 or 767.
Despite the challenges, the Lagos State Ambulance Service Lasambos, established in March 2001, offers a rare example of hope. Operating as a unit under the State Ministry of Health, the service has over 280 staff working in concert with other state emergency responders.
This is Lagos State Emergency Helpline. What is your emergency, please?
We have ambulance points along the roads where they park their ambulances, and then they can also sit down in a little cubicle there while they're waiting to be called. This allows them to respond quicker to calls than if they were coming out of their bases.
Binta and Moshood will carry the scars of their loss forever, but their pain speaks for millions across Nigeria, where surviving an emergency still depends more on luck than on medical care. Experts agree that without greater investment, training and political will, the promise of emergency care will remain out of reach for most Nigerians.
It will only make sense if we decide to revitalize our primary healthcare centers, because out of that 33,000 primary healthcare centers, only 20% of them are fully operational.
I want to see personally more states setting aside money in their budgets and prioritizing providing actually the support and the oversight that's needed to make that happen.
Whether it is a heart attack, a road accident, or a maternal emergency, crisis can strike anyone, anywhere. But how we respond in those critical moments can make the difference between life and death. Ayuba, Illiya, Gist, Nigeria.